Afternoon, everybody, and welcome to GPA Live. I'm your host and moderator, Ron Aaron Eisenberg, and delighted to be with you. GPA Live is a virtual education series brought to you by the Global Pain Association, and we have a very important show for you today. Every week we do important topics, but this one literally touches the lives of millions and millions of Americans and others, and mostly women, but not all women. We're going to be talking about lipedema, a disease that affects some 17 million, mostly women across this country. Exact patient estimates are not available because it turns out to be very difficult to diagnose. Many physicians often assume their patients are just obese. Hey, lose weight, you'll be fine. Well, it doesn't turn out to be true. On today's GPA Live, April Sluter, a social worker, creator of the lovely Lipedema Ladies, will talk about her journey with lipedema and how she manages that pain. Now, before we turn to April, we're going to welcome one of the board members of the Global Pain Association, Dr. Marianne Pinkston, a family doc who is board certified and a real expert in integrative medicine. And she is joining us from somewhere in a parking lot in Dallas, Texas, going to a Rangers game this afternoon, which is exciting. And Dr. Pinkston, great to see you.
Thank you. I'm glad to see you guys here today, too. And glad to be on in place for dear Susan, who we hope is hanging in there and doing okay. She's a great lady. And, normally Susan will take a few minutes with you, Ron, to talk about GPA. Global Pain Association is becoming a phenom now. We have, over 80,000, I think.
It's now over 95,000.
Oh, man, that is a huge jump from the last time. We are gonna break that mark, and this is so exciting because it seems like once we got traction, we just took off. So, we've got great topics every week on Saturdays like this one. I'm very interested in this. I see some patients, I've identified some, and thanks to GPA for that. So really, this is a wonderful association. We've got board members, and everybody is giving their time to lend a hand. This is a nonprofit. We are, believe me, correct me if I'm wrong. I want to make sure I represent it correctly. But this was created for patients who have pain syndromes and their caretakers and friends and family for tons of resources. So you can go to globalpain.org and find out more information. And join the newsletter so that you can see all the events that we have, like every Saturday where we give topics here. I run a support group, which I would love to have people join on the first and third Thursdays of every month from 7 to 8 on Zoom. You can find that through the site globalpain.org and the newsletter. And we also ask, please, since this is a group, we are looking for donations, funding. We're looking to apply for some grants. You can also go to the webpage and donate, and we ask that you please support us because 95,000 and growing. We're getting out there. We need some help getting all the I think I said first and third Thursdays. Maybe I meant first and third Tuesdays. Please, for the support group, first and third Tuesdays of every month, 7 to 8.
Well, Dr. Pinkston, we appreciate you being with us. We're going to talk about lipedema, come back to you after we talk with April Sluter, and thank you for hanging out in the parking lot. I hope your air conditioning is on. We hate to find a doctor stuck in a car in a hot parking lot with the windows up.
He breaks the window here and lets me out if it happens. But
okay. Well, you take care. Let's take a moment and introduce April Sluter. She has a master's in social work. She's a licensed social worker, creator of the lovely Lipedema Ladies Facebook page, a full-time social worker, and she's a certified life coach. She herself was diagnosed with lipedema in 2015. And after personally seeing the emotional toll the condition takes on women, she created that group on Facebook. She dubbed it Lovely Lipedema Ladies. It focuses on the struggles and how we can learn to accept and love ourselves and get back that self-esteem that is so important. April also offers one-on-one coaching to women who need more help walking the path of learning to love themselves. Well, April Sluter, hanging out in Cincinnati, Ohio, thank you for joining us.
Thank you so much for having me. I'm so grateful for the opportunity to come on here and talk about lipedema and hopefully, help some ladies out there who are struggling.
Now, April, we know a huge number of people struggle with lipedema, but most folks don't really know what it is. So give us the 411. What is lipedema?
Yeah, lipedema is not a very well-known condition. A lot of people have never heard of it and even sometimes mistake it for lymphedema, which is completely different. Lipedema is called a painful fat disorder. And the reason that it's called that is because it's a condition that results in the growth of abnormal fat cells in the body, typically the lower half of the body, from the hips down to the feet. The feet are usually spared. So usually you'll notice like the feet look okay. And then there's a cuffing around the ankle. And then what sometimes is called tree trunk type legs. Usually there's development of very hard nodules underneath the skin. The thing with lipedema is it gets mistaken for obesity because it looks like obesity. It looks like someone who just needs to lose weight. Well, lipedema fat is not metabolized like normal fat. So you're not just going to go on a diet or get weight loss surgery and have the lipedema fat go away. It doesn't work that way. Yeah, so that's the basics in terms of what lipedema is.
Now, when you say it is often mistaken for obesity, and that would imply that many of the PCPs who treat folks don't know what it is.
Correct. So many women who have lipedema have lived their lives being told that they just need to lose weight, and it can be very frustrating because their family and their friends and their doctors tell them this and give them suggestions and ideas, and they try all these different things, and it's like nothing seems to work. And they'll also notice that they have a lot of pain. They'll have a lot of heaviness in their legs. Their legs swell a lot. And as you can see from these photos, there are different stages of lipedema, and it is a progressive condition. Now, some people will stay, they might stay lower in stage 1 and never progress. Most people do progress over time and the condition worsens. You get an increase in pain, an increase in difficulty with mobility, and it is very difficult condition.
How is it diagnosed?
Well, diagnosis is tricky. Now this photo here is a lady, and the reason that I put her here, her name is Amanda Arlauskas, and she was a contestant on The Biggest Loser. She found out that she had lipedema when she went on the show. She had no idea. The doctor that was kind of in charge of the contestants that went on the show, as soon as he saw her, he told her, "You have lipedema." Lipedema is there's no specific test that you do for lipedema. It's usually a doctor who knows about lipedema, is trained in lipedema, can tell by look and feel and symptoms. And that's how it's typically diagnosed. But usually women seek out a diagnosis after learning about lipedema accidentally. Like, for example, myself, in a magazine article, I was reading about this young lady who was on Biggest Loser, and it talked about lipedema. And I'm like, oh my gosh, that sounds like me. I had no idea. I've never heard of this. And then you go on a journey of trying to figure out who you go to get a diagnosis, because your primary care doctor probably has never heard of it. Many women will see a presentation such as this one and hear about it, or a family member will come to them and say, I saw this thing. You might want to look into this because it kind of looks like something you might have. So it's not easy. Usually you figure it out and then you explore and try to see if you can find a doctor who knows about it.
So April, in the world in which we live, there are specialists for everything, for arthritis, for cancer, for all kinds of issues. Are there lipedema specialists, or who do you look for?
I wouldn't say there's doctors who have decided that they're going to learn more about lipedema, and they kind of become well known within the lipedema community. People share their names, and then potential lipedema patients will seek them out. I, as you mentioned earlier, live in Cincinnati, and when I learned about lipedema, I thought for sure I would find someone in Cincinnati who could diagnose me, but I really struggled finding anyone. I was able to go on a Facebook group about lipedema, And there is a list of doctors who know about lipedema that women can go through and kind of see if there's one in their area. And I found Dr. Stephen Dean, luckily enough, who is at Ohio State, and he's actually pretty well known within the lipedema community and sees a lot of lipedema patients. I drove to Columbus to meet with him, and he very quickly, after meeting me, said, absolutely, you have lipedema. It was very clear to him as soon as he saw me that I had it.
Now share that name again, Dr.
Stephen Dean, D-E-A-N. He's at Ohio State.
Now, you also mentioned to me off the air that there is a group that conducts informational series from time to time that you can tune into, listen, learn more. If you're a provider or a prospective patient, what is that?
Yeah, I was mentioning, if you go on YouTube and look up Lipedema Roundtable, every month there is a discussion with patients, ladies who have lipedema, and physicians who work with patients with lipedema. And Dr. Karen Herbst is on there often. Dr. Karen Herbst, H-E-R-B-S-T. She's kind of a rock star in the lipedema community for patients. She's been talking about lipedema for many, many years, and a lot of women seek her out, will travel across the country to go and find her and meet with her and get a diagnosis. So the Lipedema Roundtable on YouTube is a great place to go get information and learn more about lipedema. There are various Facebook groups, which we'll talk about that in a moment. But yeah, it's a great resource.
Now, on your Facebook page, you've asked people to describe the kind of pain they have, and you have some examples on this slide. This being a program, GPA Live, that tries to help people with chronic pain. Folks with lipedema have serious pain.
Yes, they do. Absolutely. And I'll kind of read through these quickly. When I asked the question in my group, I had a ton of responses, and I just picked a few, and these are direct quotes from there. Touch is painful. Sometimes it has a burning sensation, sort of like a sunburn from the inside out. Feels like my arms and legs are being strangulated. Mine is a stabbing pain. My thighs, knees, and ankles are very painful. Even clothes hurt when they make contact with the skin. Intensity of the pain varies. Some days are worse than others. Pain I experience is primarily my thighs. Feels like someone has repeatedly beat me with a bat. So sore, but she doesn't have the soreness to touch, just deep inside, lasts for hours. I sometimes separately get a pain through my thighs, which feels like thousands of pins and hot tips being pushed from the insides and through my skin. And this lady said, I know I just hurt all the time. I have pain in my legs, thighs, back. By nighttime, I can hardly move. Always feel so sick after struggling with pain all day. Pain, as you know, we all experience pain differently, and it's the same within the lipedema community. Some women don't have a lot of pain, especially if they're in stage 1. And then some women, it is as soon as they wake up, maybe sometimes their pain never goes away. By the end of the day, your legs feel very heavy and very achy. And my pain is cramps. My legs cramp. They feel like they're being twisted, and they're very heavy, and they get very swollen. It's a struggle to manage the pain.
Now, there'd be a temptation to try some of the really heavy-duty narcotics to fight the pain. Do those work?
I think that if someone gets a relief from a heavy narcotic, it's a mask, and it's not really going to help. It's important, because this is a progressive condition, to manage your pain in ways that are going to also slow down the progression. So some women may take some pain medication, but I don't find many women say that it helps very much. And it's definitely not going to help with the swelling and the heaviness that you'll feel in your legs. I avoid going to the store and shopping as much as possible, because it will just cause me to not really be able to do much the rest of the day, because my legs get so heavy and painful. Here's some more photos of ladies with lipedema. Lipedema, there's research being done on lipedema, and you'll see a couple of photos where ladies are putting their clasping their hands. that indicates some joint hypermobility. A lot of women with lipedema have hypermobility. Some have been diagnosed with a condition called Ehlers-Danlos. It is believed by a lot that there is a connective tissue component to this condition. There's also a strong hormonal component. Many women first see signs of lipedema around the age of puberty. Many women also see signs or worsening after pregnancy and around the time of menopause. So there does appear to be a strong hormonal component to the condition.
And I gather the bad news is it just doesn't go away over time.
No, unfortunately, lipedema, when you're diagnosed with lipedema, it can be a relief to get a diagnosis and to know that there's some sort of reason that you're having this issue, but you're not going to take a medication. You're not going to go on a diet and just lose all of this. You can lose any of the other fat. We still have other normal fat. Women with lipedema are, may be more likely to be overweight and have issues with gaining weight. And so trying to control that and lose as much of that fat as possible is a good thing. But you're not going to, the lipedema fat is going to be there. And the key is to try to slow down the progression of it. And there are certain things that women can do to do that.
I know you mentioned off the air when we talked the other day that even surgical procedures to try to reduce weight, to do bands on stomachs, what have you, does not touch the lipedema.
Right. I personally had weight loss surgery back in, 2003, 2004. And I did lose a little bit of weight, mostly in the upper part of my body, around my stomach and like upper torso, a tiny little bit on my legs and hips. But that surgery failed. Actually, I had the banding and it actually had to be removed because it came apart inside of me. So women who have weight loss surgery, some of them regret it. Some of them say, well, it did help me get rid of some of the other fat that was on my body and helped me feel better. But it's, again, the lipedema fat's not going to go anywhere. There's some liposuction, a very specialized liposuction that there are some doctors, some surgeons know how to do for women that have lipedema, where they remove those nodules that we talked about, the hard nodules, and try to remove as much of that lipedema fat as possible. Most women do that because of the pain and the mobility issues, and it's more about relieving those issues than the the appearance. Because even when you do that, you still many women still clearly have lipedema, and it's not going to most of the time get rid of all of it. So.
And does it come back?
Once you get the lipid, I've heard both on that. I've heard some women say that it has come back even after surgery. I've heard some say that theirs hasn't. So I think that's an individual thing. There's still so much that needs to be learned about lipedema and so much research that needs to happen. I can't say 100% on that once you have the surgery, you won't get it back.
Now, here's some resources on where to go for help and information. Talk to us about these.
Lipedema Foundation, Fat Disorders Research Society are great resources to go to. FDRS has a conference every year that a lot of ladies with lipedema attend. It's going to be in Cleveland this next year, so I think I'm going to go to it. I know Dr. Herbst has been there many times and has presented there. Now, the groups there, community is so important for ladies with lipedema because of the emotional toll that it takes on you, to know that there are other women out there who understand and believe you. And so that was one of the reasons I created Lovely Lipedema Ladies. My focus is on just self-care and self-love and acceptance of yourself, and knowing that you are worthy and that your body does not determine your worth. And so that's really important to me, that message be heard. Lipedema Sisters USA, that's a group. That's the first group I joined about lipedema. A lot of women find that group when they first start researching lipedema. There's a lot of women in there There's a lot of resources in there. Lipedema Fitness. Patricia Cornude, she created that group, and it's all about, you know, staying active and exercising and doing those things for your body that are healthy and good for you. Lipedema and Food Sensitivities is a friend of mine, Cheryl Skolage. She talks a lot about food and what you put in your body and how that affects you as well. There's a lot of resources out there, and I encourage women to reach out and look for those resources and you know, advocate for themselves if they feel like they may have this condition.
Is there, as far as you know, a connection between some foods and lipedema?
I think that there are some people who believe that there are. I think the research is still out on that. I do know that a lot of women with lipedema, myself included, do find that a change in diet can really help with inflammation and pain. Again, the lipedema is still there, but, you know, swelling and the effect that that swelling has on your body and your lymphatic system is important to manage. And so lipedema can be helped by change in diet in terms of just managing your symptoms. If there's certain foods, there could be, and some women find that certain foods definitely increase their inflammation in their body, and so they try to avoid those things.
What was the pain like, and is the pain like for you, April? What you mentioned that it feels like you're squeezed in a vice. Explain what you were going through.
If you've ever had what someone would call like a Charlie horse, like where the muscles contract, and for me, when my pain is really bad, it's like from the tops of my thighs all the way down to my feet. It feels like something is just squeezing them and they cramp. And then I will also get sharp pains in my legs as well. And it's just this achiness, and it's like you just want relief from it. The things that give me the most relief are wearing compression. Ladies with lipedema, that's usually one of the first things that is recommended to them is to wear compression. That helps with the swelling, that helps with your lymphatic system and keeping that as healthy as possible. Lipedema, as it progresses, can damage your lymphatic system. Sometimes women with lipedema will also develop lymphedema. And that brings it on, you know, it's a whole nother host of issues. So trying to manage the swelling, manage that lymphatic system, keeping it healthy, keeping it flowing and moving is so important and does help the pain. So compression helps me. Diet, I keep very, very low carb. It helps with inflammation for me. Some women find staying more like whole food based helps them. It's a journey trying to figure out what works for you. And sometimes ladies will ask in the different groups, tell me what to do. But you kind of have to go on this journey of figuring out what works for you, you know, because it's not a one size fits all in terms of what's going to help you.
April Sluter, how old were you when you began to develop the symptoms and signs of lymphedema?
Lipedema, I would say probably when I was probably around 10 or 11. You
really
see it in me. I always had bigger thighs. I had these fat knees, and my mother, she would joke with me and she would say, "Oh, you got my fat knees." I believe my mother has lipedema, but she hasn't progressed as much as I have. After puberty, definitely a growth. I always had these big thighs. A lot of women with lipedema will tell you when they were kids, they had a struggle with finding pants. You do as adults too, jeans, because you'll find something that fits your legs and your hips, and the waist will be huge because women with lipedema a lot of times are very disproportionately larger on the bottom. So it's hard to find clothes. You'll notice that when you're a child sometimes. And then after I had my second daughter, within a few months, I noticed all of a sudden my legs were just almost like exploding, the growth in them, in my hips, and my pain had increased. And a lot of women find that happens. And then now that I'm in more of the other changes of life that are hormonal for women, like perimenopause, a lot of women will have a lot of changes then too, which I'm starting to experience now. A lot of pain and issues with mobility too.
April Sluter, before we let you go, let me ask you, because I know there are folks watching today, some 95,000 tune in around the world, who are saying to themselves, I have this, or I have a friend who has this. What should they do? What would be the first steps for them to get a handle on it?
First of all, I'd like to say, feel free to email me at aprilsluter@gmail.com. I can help kind of guide you and kind of point you in the right direction. You can certainly join some of the Facebook groups. Lipedema Sisters USA has a lot of great information. There is a provider list on there of doctors that you can look by state. You can ask questions in the group. People can give you advice. Go to your primary care doctor. Talk to your primary care doctor and say, I think I may have this. They might surprise you. Maybe they know about it, or maybe they're willing to learn about it or help refer you to someone who might know about it. That you have to start asking questions, joining communities, and advocating for yourself. It's not easy, because there will be people who say, no, you just need to lose weight. That's something that a lot of women experience.
So don't take no for an answer from
Right.
your PCP.
Right.
Because you may know more than they do at that point.
You probably do.
And what else haven't I asked you that you want to share with our folks today?
You know, I just want to encourage folks, because I know as many people who has watched your shows, there are going to be many, many women who see this and recognize it in themselves, or little flags are going up that it might be an issue for them. I know that there's going to be a lot of folks who see this who say, oh, I know someone. This sounds like someone I know. Please let them know, tell them. And then please know that it's not your fault. It's not anything that you did wrong. And seek out answers. Join communities, ask questions, talk to your doctor, advocate for yourself. It's not easy. And then I would also just like to say, just please remember, when you're out in the world and you see someone who is overweight, you know, we live in a society who makes judgments about people based on their weight. We think we know just by looking at someone what their habits are, what their diet is like, what their activity level is like. And you really don't know. You don't know the health of someone else just by looking at them. So we need to be kinder and more understanding and more open-minded about the possibilities of what someone might be struggling with. So I would just like to put that out there as well.
I appreciate that. That's so important, because you're right. We do become very judgmental. Mm-hmm. And this disease is so disfiguring that it is easy to say, well, you know what? They just need to quit eating those chocolate sundaes.
Right.
Well, April Sluter, I thank you so much for being with us. A lot of folks have learned a lot today, and we really appreciate it. And I wish you the best on your journey with lipedema.
Thank you. I appreciate that so much.
Well, April Sluter, thank you. We are indebted to you for sharing this information. 17 million women and men across the country, mostly women, struggling with lipedema. Thank you, April.
Thank you.
And for those of you who are interested in learning more about the Global Pain Association, just go to globalpain.org and you can get information. You can sign up for the free newsletter and you can get a list of the topics that we've done. You can hear the shows that we have done, and you can find out what's coming up next week. And if you want to support these programs, if you want to belay some of the costs involved in putting this all together, just go to globalpain.org/donate. And we appreciate that. On behalf of the Global Pain Association, President Susan Blackwood, the executive producer of this show, my wife, Gina Galaviz-Eisenberg, thank you. That's it for today. We'll see you next week on GPA Live at noon, right here on Facebook. And coming up next Saturday, remember, Saturday the 4th, our topic is peripheral neuropathy with Dr. James Ogden. And he is a very, very knowledgeable podiatrist. And there are a whole lot of folks struggling with peripheral neuropathy, foot pain, and more. So join us next week on GPA Live. Have a great weekend, everybody. Thanks, and bye-bye.